There's a few questions you need to ask yourself. Have you been around someone with a fever and is bleeding from sores and has open sores? Do they have Ebola? And did you contract Ebola when you were around them? This is a serious threat, and you need to take cautions. You need to wear gloves. You need to use hand sanitizer. And you need to keep up to date on what's going on. Today is May the 29th, 2019. And I have new video to show you about the outbreak, and it's from 2014, and then the new one is from recently about the 2019 outbreak. So there was an outbreak in 2014, now there's an outbreak in 2019, and the CDC is really working hard to try to contain it. But if anyone is traveling from those areas where they have the Ebola and come to the United States, it's a 21-day incubation period, and you don't really know if you've got it. You can have a fever and be nauseous and all that stuff and have symptoms of a cold if you come from another country, and it's possible that you could have the Ebola. But let's listen to the CDC and the doctors that are talking about the Ebola outbreak from 2014, and then the video from the ones from 2019. So stay with the video, watch it to the end. I'll be right back after the video.
The current Ebola outbreak is the largest Ebola outbreak in history and the first ever in West Africa. At CDC, our mission is to prevent, detect, and stop disease outbreaks wherever they occur. And that's why CDC disease detectives are hard at work 24/7 in West Africa.
Hi, Greg here. I'm with Ishmael, and we're going out with our UN colleagues to train contact tracers.
In the fight against Ebola, one of the most important tools we have to prevent spread is contact tracing.
Odi? Habari, Mami?
In fact, it is the key to stopping the outbreak and saving lives.
She wanted to know how we are going on. Anybody who has been sick, anybody who has been in hospital.
Contact tracing means finding everyone who comes in direct contact with a sick Ebola patient. We ask the Ebola patient or their family who the patient had contact with since they started their symptoms. These contacts are then found and watched for symptoms of sickness for 21 days to see if they become ill. If a contact begins to show symptoms of Ebola, he is immediately isolated, tested, and provided care, and the cycle starts again. All of the new patient's contacts must be found and watched for symptoms of sickness for 21 days to see if they become ill. The process is repeated until there are no new patients.
That's how we're going to stop the transmission chain of Ebola.
Contact tracing identifies new Ebola cases quickly, so they can be isolated as soon as they show symptoms, preventing spread to others. In the event someone with Ebola travels to another country, we would use contact tracing there as well. The truth is, even one missed contact can keep the outbreak going. But by carefully tracing all contacts and isolating new cases as soon as they develop symptoms, we can prevent further spread. By working together, CDC and its partners will stop the outbreak and save lives from this devastating disease.
In the Democratic Republic of Congo have declared a new outbreak of Ebola. They confirmed 2 cases of the virus in the northwestern part of the country. Health officials are also investigating 17 deaths that may also be linked to Ebola. Teams from the World Health Organization and Doctors Without Borders are working with the Congolese government to investigate the cause of the outbreak. CBS News Chief Medical Correspondent Dr. John LaPook joins me now. All right, so John, A lot of folks remember back in 2014, there was this outbreak in Guinea, Liberia, and Sierra Leone. More than 11,000 people were killed. Is there a concern that the outbreak that we're seeing now could be as serious as that eventually?
Well, I spoke to the CDC just this afternoon, and they are concerned. They're all over this. They have a field office already there. They're working with the WHO. There have been lessons learned from past outbreaks, especially 2014, which means you have to just jump on it. You have to do standard epidemiologic techniques, meaning you identify who's been infected, you make sure that they're not in contact with other people, and you figure out who they've been in contact with, because it's very infectious. You contract it by close contact with people, bodily fluids. The incubation period is anywhere from 2 to 21 days, so that means somebody could theoretically get infected, not realize they're infected, travel to another part of the world. That's what happened with Thomas Eric Duncan, who came from Africa, you remember, in 2014, and ended up dying in Dallas and setting off all the panic in the United States.
Absolutely. What are the symptoms? You talked about the disease spreading through close contact bodily fluids, but what are some of the symptoms of this?
Well, they're a virus. There's nausea, vomiting, diarrhea, headache, fever, and a very serious complication is bleeding. So there's problems with the way you clot your blood, and you can have hemorrhage.
Well, what can the Congolese government and the World Health Organization do to try to contain this outbreak?
Well, education is very important. So you may remember back in 2014, there were customs that were being done, for example, handling bodies of people who had died, and then people got infected that way. So making sure that people in the villages themselves, the leaders of the villages, that you don't ignore them, you don't go around them, you go through them, you go to them, and you explain what's going on, and then they can explain to the people what you need to do. This is in a rural area. You hope that you contain it, but they're taking it very, very seriously, because there is the potential for somebody to become infected and then go to another part of the world and spread it there.
I think so many people remember those images from 2014.
So as they said, you got to be careful. Keep your hands washed, keep gloves on, keep a mask on if you're around people that are sick, and take care of yourself, because if you get sick, you can't take care of other people. So this is Harold with WorldTVOnDemand.com, bringing you this breaking news about the new Ebola outbreak in 2019. Check out all the links below. There's 3 links down there from the CDC, from CBS, and there's one from National Geographic, where they actually have a series out right now, a TV series explaining about all this. And it's a drama type TV show, but they really touch on a lot of the things that are going on with the Ebola. So give me a thumbs up, subscribe to the channel. I'll have another one for you soon. You guys have a fantastic day. And this is Harold signing off, baby.